ice wrap in the dressing after showering. Until then, it's done fast basically, but after that, he can get it wet in the 3 days after the dressing comes off, okay? Yeah, and like I said, he just showers, just kind of let the soapy water run over, and then just pat it dry, but just be gentle with the incisions, obviously. No rubbing them or anything like that. Okay, and then nothing about physical therapy basically until you see the doctor in the week. So, this has something to call, following signs and symptoms. Let me move a brace after that. And shower in 3 days. Never move the paper tapes. Okay. So call. There's a couple numbers to call, and I'll go through those too. But they want you to look for if there's any sudden increase in swelling and redness or warmth at the area or the knee. If you do start to notice a little bit of swelling, like I said, elevation is good. You know, ice is good, rest is good. But if all of those don't help and it just continues to get really red or swollen, okay, then give them a call. Okay. And if there's like really excessive pain, because the pain should be hopefully controlled by that oxycodone. If he does need to take the oxycodone, but if that's if the pain is really still severe, that's just not helping, then give him a call as well. Okay. Any temperature greater than 101 degrees. If he does start to develop a little fever, because that can happen after surgery, particularly for younger people, they can kind of develop a little fever. So 99, even 100, just give it, like usually a couple Tylenol should be able to just knock it out. That's usually just a normal kind of thing that the body's reacting to something strange going on, but like I said, Tylenol should just be able to knock it down. If it doesn't and it just continues to stay kind of high, then give him a call as well, okay? Particularly for the first couple days, you don't know what's going on underneath there, so the pain, the swelling like in the feet or anything, and then that fever would indicate that something's going on. Shouldn't, but and like we said, any excessive drainage from the excision or dressing, which is not stopped 72 hours after surgery. If you do start to notice, like I said, you can always just, you can unwrap, apply some pressure. That should usually stop it. You can put the fresh gauze on and then rewrap, okay? And if that still is not really helping, there's still just a lot of drainage, then call about that as well. So here are the numbers here to call. So 3 numbers highlighted. The first one is Dr. Spang's nurse. So her name is Erica, and you can call her for any of the questions or concerns that we spoke about, okay? After normal business hours, so basically after 4:30 or on weekends, you can call this number and you would ask for the orthopedic resident on call. That's the main UNC number. It's like an operator. So you just ask for the orthopedic resident on call, have somebody call you back, and then you can ask them any questions or anything. I wrote in the number to follow up as well, because they do want you to follow up within a week. Usually they have that already scheduled, but they didn't, and it's too late for us to schedule, so it'll just be something you guys can call tomorrow and just schedule it, a follow-up within a week. And it'll probably be over at that, or will be over at that place that you've seen him before, the Barrington. So any questions? Not much to do, just, keep it elevated is nice. Put some ice if you can put some ice on there, remove the dressing in 3 days, and then you can shower after that. Okay.
You can probably go back to school Monday.
Yeah, probably. And that'll be about the time when the dressing is off anyway, so he won't have to go to school with the...
That's his first question.
Yeah.
Yeah.
Yeah. Although actually, they do want you to rewrap or keep it wrapped and then that brace on, so... I say that, I take that back. He won't be going to school
Gonna wear the brace
with that
anyway.
on, yeah.
I guess it goes on the inside of his jeans, though.
Yeah, if he has something that will fit over that. And I will get you some gauze packs too. So 510. Any questions that I can answer or anything? Everything's all written out on here. And we will call you tomorrow too. We always call just to make sure that he's, doing okay. So if you do have any questions, we can always answer some tomorrow too. And who wants to sign? Does anybody?
I'll sign it, don't matter.
Okay, and then I will go get some gauze packs.
What's that sign? She went over everything.
Discharging.
Mm-hmm.
Time and day is 12.
12-4. And it is
So it's packs, there
5:15.
you go.
Thank you.
Sure.
Nice.
Let me put all this together for you. Actually, it's just this page, so, yeah. Do you want an envelope for it, or is that okay?
I've got one in the car.
Okay.
I'm gonna put it in here.
Okay, do you want me to fill this up, or you wanna just wait until you get home, or?
What?
Just wait. We'll just
Okay.
wait.
Okay.
We'll put ice on it on the way in. I think he'll be asleep anyway.
Yep.
Do we need to kind of wait till he?
Well, he's probably gonna be just kinda sleepy today, so, I mean, in terms of us, he kinda meets all of our criteria
Oh,
to
does he?
go and everything.
Wow.
Mhm.
So we're taking him out now.
If you know, if you wanna let him rest a little bit, that's fine, but, yeah, like I said, I might just kind of unplug him from everything, cause, you know, we don't really need all the monitoring, cause he's
Mhm.
stable like that, so, yeah. We could check on his pain and everything and see how that's doing, and like you said, he already has a pain medication in the car, so, you know, if you don't mind.
Bless him.
We've given him some extra fluids, and we've given him some, like they gave him sort of things to prevent any nausea and things, so hopefully that shouldn't be an issue too.
Oh, so you already gave him something.
Yeah, we gave him some, like we always give meds in the recovery room, or in the OR and everything. I'm gonna start unpeeling things here. Now that he's asleep again. But if you do decide to give him like an oxycodone, I would definitely give it with like food first.
Yeah.
We have some crackers that I can give you if you want, just to go home with as well. But he should definitely have something on his stomach before. Sorry, I'm just taking all this stuff off you.
We don't. You know, it's not that we don't want to give it to him. We just hope that
Yeah.
we can do Tylenol and be good to go with it.
Well, if the pain is not too bad and you don't want to do the oxycodone, you don't need to. But if he is feeling it, you
Yeah.
definitely use it. You know.
Yeah.
Yeah. You don't want to let the pain get real bad or anything.
Right.
So, how's your pain doing?
Nothing. Just
Just a little itching or just a little sore?
getting a little better.
Is it? Okay.
How long have you been gone?
How long have I been gone? I've
So
been
you
gone.
leave and
No,
did you leave?
I didn't leave.
You went out.
You left us
you
for a little while.
You're the one that checked out, bud.
I didn't go anywhere.
I bet
never
you hear a
said
lot
that.
in here, don't you?
What's that?
I bet you hear a lot
Yeah, I
in
hear
here.
kind of funny things sometimes, for sure. Where'd you go? I
I didn't mean it like that, did
Oh, I know.
I know.
I know you didn't. Nope, I've been here though. How you feeling? Feel sick at all or anything? Or how's that itching? Is it still?
He's just sleeping.
Yeah, just sleepy.
Yeah, a little
A little bit itching. Okay.
bit. Chili's.
Chili's. Are you getting hungry?
It's our place.
Huh?
It's our place.
That's our place.
Chili's?
Is there one around here?
There is one.
Durham.
Yeah, there's one in Durham. There's one a little ways up in Durham. I wonder if there's another one.
I could Google it.
Yeah. Emma, do you know of a Chili's close by? Do you know of a Chili's close by? Do you know of a Chili's close by?
Got that?
They
I know
trying.
of that one in
Yes.
Durham. Okay. She's my
501. If you go to
lady.
15501 from here, okay, from Manning Drive, 15501, it's actually in
Are
Durham.
you
but
talking
it's
about the
closer.
Garrett one? The one at
Yes,
Garrett? Okay,
that's what it
the
is.
one. Okay.
Yes,
Okay.
that's the
Okay.
only Chili's in here. We
That
don't have
is.
any Chili's in Chapel Hill.
Okay.
Okay.
Yeah, so it is. It's a bit north, but yeah, you would just head up, Fordham or the one that you turned off of to get here. If you just take it all the way up, like a few miles. You're gonna come to an intersection called Garrett Road. It's a very busy intersection. There's a gas station and there's a whole shopping center on the left, and there's a Chili's right in there.
Cool.
But it's probably about a few miles up there. 5 or 6 miles probably
Oh,
up
that's
there.
not
Yeah.
It's always been there.
Because
Yeah.
you got cut there or something.
Did it? I always thought it was there.
It made that scar in there.
I thought it was there. I always had that.
I think it's been there since I was born.
The mole has, but you got hit there or something one time, didn't you? Had a sore there? Something.
Mm-hmm.
And it left that little indention in it. Like a little scar. I can't remember what it
I'm
was.
still not.
Bump.
You know. You want to get your clothes on?
Oops.
Okay.
Yeah. What do you think? You're ready to go by your standards, but it's make sure if you're feeling okay and.
First day I got to sleep in. It's pretty good.
Did it? Usually don't. You have
I
to
don't
wake up
get to
for.
sleep in usually.
Okay. You have to wake up for wrestling or for what? For him.
We don't.
Why does he make
we
you
don't
hear
waste
the-
no days in the bed.
Oh, really?
Mm-mm.
9 o'clock.
Yeah, and that's pretty late, I think.
He thinks.
That's early for me. I kind of agree with you. I love to sleep in. Yeah, if you get the opportunity, I would love to sleep in.
Where am I?
You are in this is the recovery room, so you come here after surgery. So remember, you were in the pre-op area before surgery, went back to the OR, and then came back out here. It's kind of like a horseshoe shape. So this is the last leg of your journey through this surgical center.
You know, I kind of don't know where that is. Where that way, and that way.
You don't really have to know, no.
We got you, boy.
Yeah.
We're doing the driving here.
Yeah.
Can I get a wheelchair?
You will get a wheelchair, yes. And we're gonna make you run out of here.
You want all the
Do
luxuries.
you need
don't
crutches
you?
or anything, or does he have? He's been just walking around with the brace. Do you feel like you need crutches?
We
or
got
anything?
crutches.
Okay, you do.
He's been using crutches.
Okay.
Do you have my iPhone?
Mm-hmm.
Does
With
it
you
say
now?
No. It's
It'll
in the
be
car.
basically like kind of bare weight is tolerated, and to use the crutches as needed, kind of like probably what he was before. Just want to make sure. I'm gonna take this guy off, okay? So stop squeezing it. Yeah, your arm didn't seem to like it very much either. It's kind of red.
You got that sensitive skin, don't we?
He does have that, huh? We were saying that when he came in. It's just kind of red and things. Yeah, it seemed like things were irritating the skin a little bit.
Makes me wonder if he might be allergic to something.
I don't know.
His sister's allergic to latex.
Is she?
Mhm.
Okay. I don't use a lot of latex here, but could be
I don't think he is though.
related. Yeah.
Like that too when I was in the hospital.
How am I gonna get this out?
Yeah, actually, that's what I was just gonna do.
That's his first mission right there to get that thing out of
This
there.
thing off me.
Yeah.
Hmm.
Oh yeah, you can take that guy off too.
Undressing. I'm just gonna move.
The worst part of this is the tape. Pulling off all this tape. Because once the tape comes off, the actual little thing just slides right out. So that's not, yeah, so if you want to start it,
Sorry.
that's totally fine. Yep, so let's do the other side here too. Yeah, like I said, the tape is, oh hush. Okay.
Let's do that again. That beautiful sleep.
People never
Stop.
want to wake up from after this